In the face of rising suicide rates and significant increases in the rates of depression and anxiety, America is truly facing a mental health crisis. I spoke with Dr. Anthony Hassan of the Cohen Veterans Network and Linda Rosenberg, president from the National Council for Behavioral Health, to learn more about resources. We know that this is a problem, but where do we start?
Yeah, so there is a crisis in America, and this survey of 5,000 respondents really reinforces that we have some challenges in front of us. I can tell you that Linda and I started down this journey because of our own experiences in our profession and seeing it firsthand. Most recently, I've been on a journey establishing clinics across the country for the Cohen Veterans Network, and through that journey, I've had a chance to talk with patients firsthand and hear their challenges with accessing mental health care, paying for mental health care. I've talked to providers who frankly are just burnt out because of high caseloads. And then we have CEOs who are trying their best to run these community mental health systems with very low reimbursement rates and are struggling to keep their doors open. These are the organizations we need thriving in this time of mental health crisis. But we do have some good news from our study.
Stigma is no longer the #1 issue. Stations like yours, people like you who've been talking about mental health and the challenges and the need for care have indeed made a difference. We, though, still have 6 out of 10 Americans looking for help for themselves or loved ones. 76% of Americans who understand mental health is just as important as physical health. And the #1 barrier is really cost, and #2 is really not knowing where to go.
What can be done to address the mental health crisis in America?
I love what we're doing now. We're talking about it. I love that we're talking about mental illness and making it just like any other illness. And I like the fact that we need to continue to remind people that treatment works and that young people, if you need help, go get help. The treatment will work.
And Missouri has been one of the most advanced states, in fact. You were one of the founders, along with the National Council of Mental Health First Aid. Courses are available in your state and every community about mental illnesses and where to get treatment. You're also a state that's converting your community mental health centers to certified community behavioral health clinics, where reimbursement will be equal to the kind of reimbursement you get in your health centers for physical illnesses. And we have philanthropy stepping up.
Yeah, I was just thinking that, government is one place, but government sometimes just isn't enough. And we do hope through the certified behavioral health clinics that they will be made whole financially for the work that they do. But philanthropy, like Mr. Cohen, who has put up $275 million to reduce all of these barriers to care so that veterans and military family members can get the mental health care they need when they need it. And that's one of the models that I think we need to talk about as well, as government can't do this alone.
For more information, you can call 844-336-4226 or visit CohenVeteransNetwork.org.